note some tattoos, no lesions, rashes, warm to touch, light in color. And then we'll take a look at your head. Head is normal cephalic and symmetrical. Are you having any tenderness? No tenderness to the head. Take a look at your scalp. Scalp is free of flaking and lesions. Hair is evenly distributed and soft. And now we'll take a look at your face. Can you smile for me? Can you puff your cheeks out? Raise your eyebrows. Can you tell me if this feels the same? Does this feel the same? Does this feel the same? All right. Facial nerve is intact. Can you clench your jaw?
Yeah.
You also want to inspect in between your toes, so you want to open each single toe and look in between the toe, make sure there is no skin changes, no color changes, no blisters, no ulcers, anything that looks unusual or suspect than what you normally see on your foot. You should
your cheeks and smile. Smile without your teeth. Raise your eyebrows and frown and squint your eyes. Good. Okay, so now we're going to move on to your neck. I'm going to start by palpating your lymph nodes, starting with your preauricular, your postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Okay, so now I'm going to palpate your carotid pulse. Good, so both sides had a regular beat. To palpate your trachea, I'm just seeing if it's midline and symmetric, which it seems to be. And then I'm going to feel for your thyroid gland. Can I have you swallow? And swallow again. Good. So it didn't be looking at the sclera, your blood vessels, the pupils, and your lacrimal ducts. Okay. So lacrimal ducts look good. They don't look swollen or anything. Can I have you look side to side? Okay. Look down and side to side. Good. Palpate your, sorry, my hands are cold. Your chest excursion. So I'm going to have you take a deep breath in and out. Good. And I'm also going to palpate for tactile frenitus. So can I have you say 99? 99. 99. 99. 99. Good. And I'm also palpating for any crepitus or masses, and let me know if you feel any tenderness. Okay. So now I'm going to come to the other side and do the same thing. So I'm palpating for any crepitus, masses, but I don't feel any. Is it tender back here at all? No. Okay, good. So now I'm going to palpate for the chest excursion. So can I have you breathe in and out? Good, so it looks symmetric on both sides. One side didn't go farther out. And now I'm going to palpate for tactile firmness, so say 99 again.
99, 99, 99, 99, 99.
Okay, so now I'm going to percuss your lungs. Can I have you bend over? Okay. Okay, so that sounded good. And now I'm going to test for your diaphragmatic excursion. So can I have you inhale? Aortic area. The pulmonic. Second pulmonic. The tricuspid. And the mitral. Percuss each quadrant. I'm going to start with the right lower. Go. Thank you. First, I'm going to inspect your fingers and hands. I'm going to test your cap refill. Okay, so they refilled within less than 3 seconds, which is perfect. Now I'm going to inspect your hands and fingers. I'm looking at the color, the temperature. They seem to be a little cold, but nothing to be concerned about. The color is nice and pink. They don't look purple or anything. Now I'm going to palpate your carpals and your metacarpals. I'm feeling for the joints. Let me know if you feel any tenderness at all.
It's like a little miniature massage.
Okay, good. Perform graphesthesia, so you're going to keep your eyes closed. I'm going to draw a number or a letter in your hand, and you can let me know what it is.
See? And
And now we're going to do 2-point discrimination. So I'm going to touch a part of your arm. There we go. With 1 or 2 points, and you're going to let me know if it's 1 or 2. So can I see your one?
yes. 1, 2, 1, 1, 2, 1, 2, 1, 1.
And your dorsalis pedis. And then your posterior tibial. Okay, good. So all of your pulses felt bilateral. They didn't feel too strong, too weak. They felt nice. So now I'm just going to look at your feet. I'm looking at the color, and I'm feeling for the temperature. They feel a little bit cold. And I would test for your cap refill, but your toes look nice and painted. Good. So I'm also going to check for your for any edema in your ankles and feet, but reflex. Your very strong reflexes. Good. And then the Babinski. So I'm looking for your toes to curl. Okay. All right, so that concludes.
Skin feels warm. There's no cold temperature or cool temperature anywhere. And you open up each of the toes again. Look in the bottom of the toes. Look in between the toes. Make sure you don't notice any color changes, blisters, ulcerations, or any lesions that look suspicious. Inspect the whole entire feet in between the toes and in the bottom and make sure there are no blisters, ulcers, open sores, or anything.
You can also do something come back to neutral. Inversion, where you rotate in a little bit. Inversion, and external rotation, or eversion the other way. Okay, that's enough for range of motion in the foot and ankle. See the fibula, you can see the tibia, you can see part of the talus here. This lateral process talus is a tricky one because that fracture happens, x-rays are negative in 40% of patients and can cause severe disability if we don't pick up this fracture early on. The fifth metatarsal, and you can palpate the base of the fifth metatarsal, the talus, the fibula, and the tibia, and the joint. You can feel the joint. You can feel on the inside part the anterior tibialis, which comes and attaches to the navicular bone. And if we rotate out the ankle, we'll see the posterior tibialis come across and attach right here to this, we call the in spot, because of the common injuries in the navicular bone. Now to check back here, you'll check the digitorum and the flexor hallucis, and if they have a stress fracture or a soft tissue injury, we can also axial load the metatarsal individually. So this is the third metatarsal. So if they have a stress fracture, it'll hurt with palpation, but so can a soft tissue injury. But if we axial load the third metatarsal with pressure through the phalanx, and that hurts there, that's a sign of bone injury and not a soft tissue injury. The foot, you can feel the plantar plates, and if you extend the toes, that might irritate someone like a dancer who has a plantar plate injury. The MTP, the first MTP, is the most injured joint for dancers and non-dancers alike, football players. The first MTP, gout, can also cause pain and swelling here.
যদি পেশেন্টের এই গ্রেড টোটা যদি এদিকে হয় এবং অন্যান্য আঙ্গুলগুলো যদি এরকম ফেনি হয় তাহলে এটা মিন করে পজিটিভ, বেবিনস্কি সাইন পজিটিভ। আর যদি টেস্টটা করার সময় যদি সমস্ত আঙ্গুল প্রায় এরকমই যদি থাকে, হ্যাঁ, প্লান্টার ফ্র্যাকচার যদি থাকে, তাহলে এটা মিন করে নর্মাল অথবা নেগেটিভ বেবিনস্কি সাইন। করার সময় আমরা যেটা করব যে একটা শার্প একটা নিব, নেওয়ার পরে আমরা লেটারাল এই সোলের লেটারাল পাশ থেকে শুরু করে ঘুরিয়ে আমরা এই গ্রেড টো পর্যন্ত আনবো। আনার পর দেখবো যে তার আঙ্গুলের মুভমেন্টটা কোন দিকে, গ্রেড টো থেকে আসে, তাহলে আপার মোটর নিউরোশন নাই। আমরা এখন করছি এটা। অলমোস্ট মোটামুটি এই পেশেন্ট নর্মাল, কারণ হলো এটা এক্সটেনশন যায় নাই। এটা দেখে আমরা
and we'll be seeing abnormalities in hand like pallor, hypothenar eminences, thenar eminences, dupuytren's contracture if there is any abnormality, and then very important thing, nails. There are a lot of findings in nails like cyanosis, clubbing, similarly splinter hemorrhages. You can find leukonychia. What you will be doing then, you will be palpating the pulps for osseous nodes. Similarly, you will be palpating the fingers for Ebenden's node, Bouchard's node. You will be looking at the dorsum of the hand for intraosteal wasting, like in the setting of rheumatoid arthritis or small muscular problems, small muscle diseases. So this is how you will be seeing these things. As you will be shaking the hand, you will be looking for warmth, different kind of things which will be examined. So what we'll be seeing here at left, it's better to see thyroid in extended position of neck. ऐसे जैसे पानी का बूंद करते हैं. So that way you will be examining for thyroid. ठीक हो गया. And then I am looking for this sacral region. How to examine these lymph nodes? This is submental group. This is submandibular group. This is jugulo-omohyoid and jugulo-digastric group. Then this is anterior cervical area. This is supraclavicular area. This is posterior cervical area, pre-auricular area. This is post-auricular area. And here we are palpating the occipital area, right? So that is all about this lymph node exam.
Lymph nodes here, so I'm just going to be feeling back there, just your jaw, underneath here as well. Okay, and then here. Okay. And if you can, please clench your jaw for me. Clench your teeth. Good. Okay. Now I'm going to check your sinuses. You just let me know when you feel any pain or anything at all. Okay. Little remnant. Let's see. Any nasal drainage you noticed?
No, nothing out of the ordinary.
Okay. Alright, so we're just going to do this. So push down here, and if you could just raise your eyebrows for me. Perfect. Alright. Okay. Just going to check any preliminars. If you could just push against me to the other side. Great. And perfect. Thank you.
Side to side, same thing as the knee. Now where I am right now, if I'm having him do a step up, he's probably going to knee me in the face, so I don't want to be there. If I was doing single leg stance, it doesn't matter. But if he's doing a step up, I want to be here. Okay, and it's just a lift. I'm not cramming them together. What has to happen biomechanically at this ankle if he goes into dorsiflexion? No, and it's going to appear way more dysfunctional and possibly more painful for the patient. So it's a lift. It's not a solid compression. I don't want to prevent that talus from gliding. I'm just giving a lift. So are you okay to do a step up?
Yeah.
Okay, so I'm lifting here, I'm squeezing. My elbows are tucked in. They're not as far down as they could be because it's the ankle and I can't get them any further. Okay, go ahead, stand up. Just like that. Okay, the knee, when we did the knee step, move. And then around that calcaneus, I'm going to encourage slightly, maybe I moved him a degree into a little bit of that calcaneal inversion. Okay, so this is a nice, stable, stacked foot. With the heel of my hand, I'm putting a little tiny bit of pressure, not a lot, but a little bit of pressure on the ball of the big toe because I'm encouraging it to stay down. If he goes into supination, I'm going to allow it, but I'm just giving an encouragement for how that foot should go. The forefoot should stay down, the arch should lift, and I'm just giving him that encouragement, and come on up.
Maintain pinch while reading caliper. Read dial on caliper between 1 to 2 seconds after lever has been released. Nearest of 0.5 millimeters. Take duplicate measurements at each side. Rotate through measurement sites allows the time for skin and underlying fat to remain normal thickness. Male and female skin fold measurements are 7 sides: triceps, chest, pectoral,